Coast to coast, dusk to dawn.
SightPath is on the move.
Mile after mile, all year long.
SightPath is on the move.
Our 200 employees travel 3 million miles a year.
To help our customers provide quality care close to home.
All we do is eyes.
All day, every day.
Every day.
Join the movement.
Dance set the stage for the AAO 2014 opening session. Academy Secretary Dr. Jonathan Rubenstein highlighted some of the top events, which include
the transition we've made towards smaller, more informal learning formats like what is behind us here, which is the Learning Lounge, where people can more informally meet with each other and get a chance to learn more in a small format versus a large lecture format. And we're going to have more and more of those kind of opportunities. Academy Cafes are another opportunity for smaller, kind of informal learning where there's more question and answer interchange between the audience and the speakers.
Another informative and engaging day here in Chicago. I'm Rachel KOPCZYK for AAO TV. From featured lectures to top scientific posters, AAO 2014 is the place where all ophthalmologists meet.
The highlight of his life is his family. So from chasing cows and catching butterflies in Kentucky to unraveling and curing eye cancers at Wills Eye Hospital in Philadelphia, that is the life of Jerry Shields.
An AAO standing ovation for Dr. Jerry Shields, the 2014 Laureate Award winner. His wife, Dr. Carol Shields, spoke about his lifelong dedication to his career in ophthalmology, as well as their work together in ocular oncology. Dr. Shields graciously accepted his award.
It was the most unbelievable award I could imagine. I didn't think I deserved it, but somehow it happened. And it was a pleasure to be here and talk to so many good friends who've worked with us over the years. And we're so happy that my wife Carol and 4 of our 7 children could be here with us today.
This year's Jackson Memorial Lecture took a look at the last 50 years of progress in retinoblastoma. Dr. Hans Grossniklauss, the featured lecturer, says that nearly all patients with retinoblastoma in developed countries can now be cured of their primary cancer, a remarkable achievement for a childhood cancer that once was uniformly fatal. Going forward, the main challenge will be ensuring that access to care is available for all children, particularly those in developing countries. There are several ways ophthalmologists can make that care available.
I think education, screening programs, public awareness programs, establishing retinoblastoma treatment centers or areas of care in some of these regions, but sort of being able to get to the treatment areas and then doing things like twinning.
You can add value to your practice by attending the annual meeting in many ways, including getting hands-on experience in the on-site labs. Cross-linking is a technique used mostly for keratoconus. It's a strengthening procedure that uses vitamin riboflavin and ultraviolet light. The combination includes oxygen-free radicals, which increase the rigidity of the cornea by over 300%.
We're seeing very, very good results from all the European surgeons who have been using it for more than a decade, and we're seeing good long-term results. Additionally, it's almost gained a little bit of notoriety now because in the U.S., which is the only country in the world that doesn't have FDA approval for collagen cross-linking, I think people are starting to, there's a lot more buzz, people are starting to really want to know more about it. And someday it will be approved. There are a number of centers that are performing cross-linking now with excellent results in the U.S., so I think it's important for all surgeons to be aware of this technique.
Practicing proper patient safety can lead to a prosperous practice. This session covered innovative patient safety education and training tips to support the lifelong practice needs of surgeons. Attendees were encouraged to maintain open communication during a live surgery. The surgeon should talk through the procedure, and a nurse or other team member present should repeat the steps to ensure proper execution.
Oftentimes when if you go and see a sports team, or you go to an orchestra, or you go to a ballet, you see people warming up before they actually perform. And yet we go into the operating room or do a procedure without the warm-up. So there's no question that the hand-eye coordination has helped with the warm-up. But what I was mentioning during my talk was that those generic warm-ups help. But what helps even more is procedure-specific rehearsal, where you can feed the data of the patient, image-based data and other data, and you can actually perform the procedure in a simulated environment, which gives you the patient-specific information so you can transfer that into practice, which would help in the outcomes and safety.
The scientific poster area is an extension of the ongoing educational mission of the American Academy of Ophthalmology. These eye-catching posters are meant to deliver condensed information on subject matters to attendees passing by.
The posters are always interesting. They conjure up a lot of different diseases that you don't always see. They get you thinking. They give you the latest approaches to these things. There's a lot of clinical usefulness embedded in the posters if you read them carefully enough.
I like just walking around the poster sessions and unexpectedly coming across posters and seeing, things that interest me spontaneously. There are some posters that I looked at the titles beforehand and I thought they might be of interest, but really I've just been walking around and running into things that I never thought I'd catch. I just saw a poster that looked at ocular trauma over the course of several years, nationally, and it shows some pretty interesting trends, which I think have really big implications for how to prevent that sort of problem.
Taking a look at the view across the pond, in the joint AAO SOE session, doctors discuss the current cataract and IOL practices in Europe and the US. Different regulations often give you more possibilities in Europe.
There were several differences. One was actually about presbyopia correcting lenses. In the US, we're limited to what we call multifocal lenses, which really are more like bifocal intraocular lenses. And in Europe, they have a newer lens that's really a trifocal intraocular lens. And so they were discussing the results of the efficacy and the outcomes with the trifocal intraocular lens.
IOL, which we use for more than 30 years in Europe, is not FDA approved here in the United States, and we think that's a pity for the American ophthalmologists, because it's a very simple lens which can easily be fixated at the iris plane.
The regulatory process with the FDA in the US can be too expensive and time-consuming to get new technologies approved, so the US often looks to our European colleagues to learn about new innovations. You can connect with your peers on social media by using the hashtag AAO2014. And one of the big questions being posed is, what advice would you give to a resident?
Well, I tell our new residents that they are the cream of the crop. They're the luckiest physicians in the world to be starting out in the field that they've chosen in ophthalmology. But they're going to have to work hard, and they're going to have to be prepared for many challenges going forward.
Be kind to the patients.
Work really hard. Take every rotation very seriously, because you never know what you'll end up being interested in the end. Try not to make too many long-term choices early on.
Do what they love. Let them be themselves and enjoy what they're doing. There is a lot to gain for themselves and for their patients.
Learn as much about practice management as you can during your residency, because once you graduate, you'll be in the middle of healthcare reform, electronic medical records, and many other challenges.
Treat the patient as you yourself would want to be treated.
Get involved in some way to give back to your profession. You'll get so much more out of it, out of what you've done service-wise.
Understand how important what they tell their patients is to their patients. If they give them some hope, if they give them realistic hope at the end of their visits, it will improve the quality of life of their patients immeasurably.